Hi, my name is Sophia. I'll be your nurse practitioner today. And today we will complete a focus assessment and we will go over your cardiovascular system, your lungs, and your chest. I will defer the breast examination, but will include the portion in my written documentation. My patient has given me verbal consent to proceed. I already washed my hands to verify my patient's identity and ensure privacy and comfort. So we want to first start off with our lung assessment. To start with the chest and the lungs, I'm inspecting the chest shape for size and symmetry. The chest appears symmetric with a normal AP to lateral ratio of about a 1 to 2. Can I take a look at your back real quickly and just set up for me? Is the ratio for the interior and the back is 1 to 2. I don't see any deformities, any retraction or use of accessory muscles. The respiratory rate and rhythm appears to be even and unlabored. So I'm going to do just count your respirations really quickly. Just breathe normally. And I'm just taking a look at my watch. And I will say her respirations is a 16, so that is within normal ranges. I'm going to take a look at your hands. Can you just do your hands like this for me? Just like this. Yep. And I don't see any clubbing of the fingernails. I'm just going to take a look at your nails. I don't see any cyanosis to the nail bed or anything like that. Now I'm going to palpate for tenderness, lesions. I'm looking for crepitus. Often crepitus is seen when someone has emphysema and the fluid or oxygen get trapped into the subcutaneous layer of the skin. So now I'm going to just check for crepitus by palpating. And I'm using my fingertips in a systematic approach, and I'm just trying to see if I feel any crepitus, and that would feel like Rice Krispie. No crepitus noted. I am also going to feel in the back, so I'm just going to have you just swing your legs over just a little bit, and I'm just going to feel for the back to see if I feel any crepitus. And I'm just palpating, and I'm also going on the lateral side as well. No tenderness or crepitus noted. Now I'm going to test and check for tactile firmitas. And what I'm going to do is place my palm on your back, and when I place my palm on your back and on your interior chest, I just want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
I'm also going to do the lateral side too. So, firmitas is equal bilaterally, also on the anterior and posterior. If it was increased, that would mean the consolidation could mean pneumonia, and if it was decreased, the consolidation could mean that there may be some type of obstructive disease going on with her. Now I access for thoracic expansion, and I'm going to check around the T9 and T10, and that's just with my thumbs close together. Lean forward. And I'm going to ask the patient to, take a deep breath for me. Thank you so much. The expansion was normal expansion. It was symmetrical on both sides. She breathed in well. Thank you so much. So now I'm going to percuss the interior portion, and you can lay back, that's fine. And start at the clavicle. Thank you. And resonance is heard throughout the exam, which shows that she has normal lung field. I'm now going to assess for diaphragmatic excursion. Now I'll assess diaphragmatic excursion. I'm going to have you to exhale and hold, okay? I'm going to have you inhale. I'm going to have you inhale deeply and hold. And you can let go. You can breathe out. And then I'm going to just percuss again. Okay, and that is dull, because I can barely hear it anymore, but I am going to also do it on the opposite side. Then I'm going to have you inhale. Inhale there, and then exhale. And I'm just going to percuss, and this is dull here. I'm going to do also the opposite on this side as well. And now I'm going to ask you to exhale and hold. And I would tape here. And then I'm going to have you to inhale deeply and hold. Okay? And you can let go from me. And I'm going to do the opposite side. And relax. And now I'm going to have you inhale deeply and hold. And relax. Excursions are measured. Let me measure you now. The back. 3 centimeters. 3 centimeters. Here you are 3 centimeters and 3 centimeters. And that will indicate that her excursions are measured about 3 centimeters, which is in normal limits. If it was dull, that could indicate consolidation. Now I'm going to listen to her lung sounds. I'm going to have you breathe in and out normally, okay? Breathe in. Again. Then I'm also going to listen laterally. Again. And then here. And then I'm going to listen the interior side. Breathe in. breath sounds are clear and equally bilaterally, no adventitious lung sounds. I don't hear any wheezing. I don't hear any crackles or ronche or any rubs noted. So your lung sounds are clear. Thank you so much. Hi, I'm just going to, I have Torian here, and what I'm doing here is doing another inspection. I just want to here check and palpate for any lesions or check for crepitus and any lesions on the skin. I'm also going to palpate here for the suprasternum notch, which indicates that the trachea is midline. I am also going to listen to your lung feel, and I want you to say 99 every time I move the stethoscope, okay?
Okay.
$99, $99, $99, $99, $99, $99, $99, $99,
Can you say that for me?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And I also checked on the lateral side, and what that indicate for me is that if I was to hear 99, because it did get dull towards the lower posterior of your back, and that would indicate that the patient has some consolidation going on. I would also check, I would also use the echophony test. That is also another option to check his lung field. I would have the patient say the letter E as I'm listening, and if I was to hear A, that would mean some consolidation going on. I also would do the whisper test, and I would tell the patient to whisper 1, 2, 3, and if I was to hear 1, 2, 3 clearly, that will also indicate some consolidation going on. All right, so you did really well. Thank you.